Dr. Berkley.
Hi there.
Hi there. Good morning. How you doing today?
I am doing very well indeed. And you?
I'm doing quite well, man. Thank you for joining us today. I was just talking about what the past year's been like of this lockdown, um, the sort of distance, the social distancing, the sort of mental and physical challenges that have gone along with this pandemic. A lot of us have had tougher times paying our bills, providing for our families, and in many cases, we know someone that we've lost, right? We're turning the corner. Vaccines are being more readily available, but does it mean that we're out of the woods? What actions need to be taken in order to get beyond this acute point in the pandemic? And that's why we have you here to speak. So thank you for offering your time and your expertise.
Thanks so much for having me. And, I think one of the important things to say is I agreed with everything you said, but I'm thinking about the rest of the world as well.
Right.
And, when you're in a country that doesn't have the resources of the United States, you have people who really are hand to mouth, don't have refrigeration, don't have running water. For them, the idea that you go into a lockdown, that you can't work is impossible. Now, I know we see that in the U.S. as well, but it has just been a really tough issue. And for example, in India right now, they've got the worst outbreak in the world,
Right.
and very, very hard to do some of the things that were so difficult that we had to do to try to break the back of this before there were vaccines.
So, talk to me a little bit about Gavi, the Vaccine Alliance, and what your role is in trying to fight against this COVID-19 right now.
So the way Gavi got set up is about 20 years ago, we realized there were powerful new vaccines that people were using in wealthy countries. And the most useful place they could be used is in poor countries, but they didn't have the ability to buy them. They didn't have the volume of production. So Gavi was created as a public-private partnership. And it's been very successful. We've introduced 500 new vaccines in the
Okay.
poorest 73 countries. We've vaccinated now close to 1 billion additional children and reduced vaccine preventable diseases by about 70%. So, a really important, and we work with WHO and UNICEF and the World Bank and, the Gates Foundation, many partners to do this. But when COVID appeared,
Yeah.
we said, my God, we're going to need vaccines for COVID. And that's when we created this new organization, COVAX, to try to get vaccines not just to the poorest countries, but to countries that don't have access around the world.
Okay. So talk to me about what it's going to take for an equitable distribution of vaccines. What do we need to do in order to make that disparity less?
Well, there's three things. The first thing we needed to do is make sure that the systems were set up, that, vaccines, for example, the Pfizer vaccine gets stored at minus 80 degrees. You need special fridges. The Moderna vaccine, minus 20. The J&J vaccine, 2 to 8 degrees. So those are three different cold chains.
Very.
So we had to have cold chain. We had to have systems set up, supply chains. And the good news is those had been worked on for other vaccines, except the ultra cold chain. And so now, we were able very quickly to bring these vaccines forward. So that's one, you need the systems. The
Right.
second thing you need, obviously, is money. But the third and biggest challenge we have right now is getting more vaccines. Just like you've seen in other wealthy countries, in Europe and other places, the shortage of vaccine. In poor countries, it has really been terrible because, in some sense, naturally they're at the back of the queue. And that's why we've been working very hard to try to create this global political movement for people to say equity is critical. And the reason is we're not safe unless everybody's safe. And you've seen this with the new variants that are popping up all over the place. If we have a large part of the world that isn't vaccinated, we're going to see new variants, and they not only threaten those countries, but threaten us.
Okay. We're not all safe, and we're not safe unless everyone is safe. I'm hearing that message pretty loudly and clearly. So, in terms of distribution of vaccines, is it easy for countries that have extra, if there is such thing at this point in time, or surplus to share theirs with other countries that are less fortunate? Or is that a difficulty based upon this refrigeration that you were talking about?
Well, we hope right now that countries will do it. And the good news is many countries have bought much more vaccine than they need.
Okay.
And so we estimate now that there's actually about 1.6 billion doses beyond what is needed to vaccinate their own citizens. So
Really?
we really want to see vaccines be donated.
So can you talk to us a little bit, especially right after the J&J thing? I know the CDC just sort of put it back on the table, and I think it's actually being distributed again today in the United States. Talk to us a little bit about, the safety of the vaccines. Should people be hesitant? Do you want them to wait longer period of time before so they can get more information? Like, what should they know about how safe the vaccines are right now?
So the first thing to say, and this is true for us, we want to make sure that we only roll out safe vaccines. That's why it's really critical to do these very large clinical trials and then to have independent regulators look at the data. Now, the thing is we've moved quicker than ever in history. So the previous record was 4 years for a vaccine. Ebola was 5 years. We worked on that.
Yeah.
This vaccine, as you know, was less than a year.
Right.
Now, very big trials were done, but that's why the regulatory agencies are so careful when you see a side effect, because basically all vaccines have some side effects, and what you want to make sure is to understand whether those side effects are such that they affect the benefit to the side effect ratio of those products. And what the FDA did in this case is they looked at it, and what we know is that COVID causes this rare blood clot that what people were worried about. And it produces it at 10 or 20 times the rate of the vaccine. But those were the questions that people wanted to ask.
Yeah.
And so, there are side effects, they're rare. And that's why you've seen during this whole time people watching very closely to make sure that we understand how these new products work in people. But everybody who's looked at this from a science point of view has said these vaccines are safe, they are effective at preventing death and severe disease and hospitalization, and benefit to side effect ratios are good.
So in your opinion then, in terms of a timeline, if you have access to the vaccine,
get vaccinated.
Sooner is better than later.
Absolutely, because the issue is you want to protect yourself,
right,
but as importantly, you want to protect your family, you want to protect the people around you. And what ideally, and you were talking about this when I joined, is you want to get to a place where there is herd immunity, where we can just suppress this virus and go back to living lives as normal as we possibly can. My big issue here is to remind everybody that even if in your community everybody's vaccinated and you think it's fine, you don't want other places to be incubating new viruses that are worse than these viruses, and that's why we have to make this global.
Okay, I appreciate that. I know there'll still be some reticence or whatnot, but I think coming from your mouth, other than mine, gives it a little bit more validity. So I appreciate you sharing that opinion. Here's one for you. You're a medical professional. You've been an epidemiologist for years. This thing happening, it almost feels like something out of the movies, the outbreaks and virus movies. Did you see something like this coming? Is this unanticipated? Like, how does it land on you?
Oh man, you asked that question. So I'll tell you a funny story about that. So about 6 years ago, Bill Gates did a very famous TED Talk where he said, that there's going to be another pandemic. I gave the back-to-back TED Talk with him, although that one wasn't so famous. And what he basically said is it is epidemiologically certain that we're going to have other outbreaks. And then he said, well, why are we not getting prepared for it? For the military, we do war games, we have all of this extra preparatory things we do in case there's attacks. But for infectious diseases, we're not working to prepare. That's what he said. And my talk was really about what could we do to begin to get ready, that we could scale up vaccines quickly, that we would be in a position to test them quickly and have the systems in place. So I think what it's important for everybody to understand is we're in a race. You know, infectious diseases have been there since before we walked on the earth. We have got lots of tools that are really good to control them, to protect them, but they are constantly changing and adapting. And look at how fast this virus spread from a
Yeah.
point outbreak in China to 180 countries in the course of a couple of months. So what we need to do in peacetime is prepare for this and to invest and have people understand and work together to try to prepare for, you know, ultimately what the next one is going to be, so we can get over them quicker, so we have the tools in place.
Right on, Doc. I have a personal question because I'm about to get my second shot today, and everybody talks about the second shot having a bit more of an effect or whatnot. Anything to do to mitigate the side effects of the second shot?
So which vaccine are you getting? I presume one of the
Pfizer.
mRNAs.
For
What? The
Pfizer.
Pfizer?
Yes, sir.
Okay. So I think, you know, the first thing to say about that is the people who get no response are the ones who are more nervous, because they're like, hey, did the vaccine work? You know, is it okay?
Yeah.
When you get a reaction, it is your body is telling you, you know, hey, I'm prepped now. You know, now you give the second dose, which is not the disease. You're not getting the actual virus, but you're getting some of the signals from the virus, and your body is saying, hey, wow, I know this, I'm going to attack it. And
Okay.
so it is not a bad thing at all to have those side effects. But,
Okay.
you know, what you can do is you can take, you know, acetaminophen, Tylenol,
Right.
to do that. And the one thing I'd say is don't do an Instagram live, or, you know, do something like that. Be prepared that 6 to 8 hours after you get it, you know, you might feel a little flu-like, because your body is, oh my God, I've been attacked again. Let me fight
Right.
it back. That's what's happening. But people should not be alarmed. And by the way, older people tend not to get such a reaction. So, you know, you get then the opposite side. You know, person sees their young kids get a big reaction, and then they call up and the doctor and say, oh, I didn't get any reaction. And that's okay, because these vaccines are very effective.
Okay. I appreciate that. And before I sign off, is there anything, what would you like in terms of a call to action to the people who are watching this interview? Is there any action that you would like them to take as a result of listening to this conversation?
Well, I think the most important thing is when we first started talking about this, you're only safe if everybody is safe. You know, people were like, yeah, you know, I'm worried about my friends, my family, my, you know, my country, my community. And I think when the new variants appeared, people really got scared. And that's one of the reasons there was like a vaccine panic and the world was trying to buy it. And we are seeing outbreaks. I mentioned India, but Brazil, I saw that come up on the comments. Other
Yes.
places in the world are having really bad outbreaks now. So I think what we have to have is this sense of solidarity, because we can provide vaccines for the whole world. What it needs to mean is that people are going to ask their political leaders to work to try to make that happen. And let me explain why.
Please.
So today we vaccinate prior to COVID, about 3.5 billion people a year, plus with flu, maybe another billion. So maybe 5 billion doses of vaccine a year. To get COVID vaccines out to everybody, we're going to need to triple the world's production of vaccines. That means we have to have no export bans. We got to have raw materials. We got to have companies able to get the equipment they need, and we've got to work to scale up around the world. To do that, we need the political support of governments. As I said, we need the money to do it. So if people are listening and care about this, you know, talk to your own leaders, your own governments about the importance of paying attention. This global problem needs a global solution. We also need the local solution, but we really have to pay attention, because if there are countries in other parts of the world that are getting no vaccines, then that will be a problem for those countries, but for everybody else. We won't go back to normal. We won't have trade. We won't have tourism, and we'll have fear of these new viruses appearing.
Right on, man. Thank you very much for your time this morning, Dr. Berkley. I appreciate the conversation. I appreciate the information, and hopefully This call to action will inspire folks to put the necessary pressure on our leaders to make sure that our response is not nationalistic, it is global. Unless we're all safe, none of us are safe. Thank you very much, sir.